So with that, I'll pass on to Elisa now, and she can introduce the rest of the colloquium.
Thanks, Kat. I am really pleased to be having this discussion. This is a seminar that those of us on this panel have been discussing in various ways all summer and have been quite eager to have this discussion. And having it in the context of public interest technology instead of in the context of pandemic response alone adds an extra layer of complexity to this discussion and some additional issues that are going to, I think, give a somewhat different spin to a conversation or a set of issues that all of us may feel that we've heard quite a lot about, and all it does is get more confusing and more complex. In order to cover this from the various facets that really do add some light, some illumination to the issues, we have with us Bob Cook-Deegan, who's a professor at SFIS, who will be speaking about medical innovations and the way those impact public responses to COVID. Kevin Dooley, who's a professor in the business school at ASU, is also a supply chain expert and a sustainable business expert. Anna Muldoon is a PhD candidate in our school. She is also part of the COVID modeling team at ASU. So she's been doing a lot of the kind of analysis that you hear about in the news all the time about whether the virus trends are going up or down and positivity rates and all that sort of thing. As each person comes into the conversation, I'm going to ask everyone to talk a little bit about yourselves and explain why you're interested in COVID at all, because this is not an issue that most of us were thinking much about before about 6 months ago. And I think that that will also give a certain sort of good lens to the idea that this issue is something that applies to everyone, that has a number of elements and that we can actually understand them in an integrated way. So one of the things that I want to, you know what, there's my technology issue. So there are the shots of Kevin and Bob and Anna. I want to talk to you a little bit about why we are putting this particular combination of words together. Why are we talking about innovation and public responses with regard to the pandemic? So for one thing, let's define some terms. Innovation means to do whatever it is in a new way. And in this particular case, with regard to this pandemic that's widely described as being unprecedented and complex and having lots of intricacies that we're still only discovering, there have been a number of elements in the public response to the pandemic, to managing the pandemic. There have been crisis management innovations in the public realm, in the governmental realm, in the medical discovery, implementation, service delivery realm, in terms of the economics, in terms of understanding the impact on the economy, in terms of developing new ways of trying to carry out economic activities when we can't be in close contact the way we traditionally are. There have been innovations in scientific investigation and assessment. So beyond the kinds of modeling that Anna's going to be talking about, there's also been a lot of a ramp up in scientific investigations about things like masks and materials and how to understand the mutations in the virus itself and a whole range of things. There's a whole area developing in indoor air quality focused on mitigation and adaptation. Civic engagement is something that we'll touch on a little bit here because it is on the one hand part of any kind of public response to any kind of crisis. But on the other hand, it's particularly interesting in the case of the coronavirus because civic engagement has popped up in a variety of unexpected ways to some degree to deal with some of the unprecedented nature of this particular crisis, and also sometimes to compensate for what are viewed as gaps in the responses in other areas. So here's another thing that we want to talk about. When we talk about public interest in the term public interest technology, there's a tendency to think that it means a particular thing, that it always means that we're looking for fairness and equity and inclusiveness. The thing is that public interests are studied by a lot of social sciences because there are a bunch of different kinds. There are a bunch of different ways to understand what public interest means. For our purposes today, one of the things that I want to stress is that public interests are always grounded in some conception of social ethics. And there are a lot of social ethics that people can pull from. There are a lot of philosophies about ethics. But I'll pull out a couple just to sort of give you an example. So one way of thinking about social ethics is that whatever you're doing, whatever your responses are to a crisis, the idea is to benefit the most people, the greatest number of people. Another social ethic would be that in your responses, you're trying to benefit the people that are the most privileged. So not the most, but the most privileged. Or that you're trying to focus on the people that are the most vulnerable. Or that you're trying to develop a response that's the most equitable across the board. And there are names that we associate with these different things. So a focus on responding in a way that benefits the most people is a version of utilitarianism. To focus on the most vulnerable is a social justice ethic. To focus on the most privileged is, there is actually a thing called power ethics. It's a Mitist ethical principle. And to focus on the most equitable arrangement is an egalitarian one. So these are not just philosophies. These philosophies of social ethics, they underlie governance systems. They underlie the kinds of governments that we create. Let me move this out of my way so I can see. When we talk about things like monarchy or plutocracy, oligarchy, democracy, autocracy, these are governmental systems that are each rooted in assumptions about which kinds of social ethics we are caring the most about, which social ethics we want to institutionalize and operationalize in how we do things. So rather than be airy-fairy or vague or sort of abstract, social ethics are the foundation of pretty much everything we do. Social ethics turn into the institutional arrangements of governance. What does that mean? It's another kind of abstract sounding word, but it translates into the rules, the laws, the way economies work, what counts as a crime, what the government looks like, how we define safety, what the jurisdictional responsibilities are across different levels of government, and significantly, it determines what we think is valuable enough that we invest our public resources into achieving them. So in this particular case, I'm just going to make an assertion. I'm going to assert that in the United States, we believe that democracy is the governance structure that we're operating from, and that the social ethics that underlie that are that we're trying to benefit the most people in the most equitable way. That's what we think of as going along with the form of government that we have. Now, if we're doing that, then our public responses would have a few different goals. One would be to build social cohesion. Another is to support social stability. Another is to promote public safety, public well-being, economic stability, and security. Now, there's a lot in the news. There have been a lot of analyses that are not yet complete about whether or not the federal response has been adequate in many regards. One of the things that's interesting and important to understand in the context of innovation and responses is that when the federal government doesn't do what the federal government normally does, which is where a lot of the criticisms have come from in terms of federal response, that is a form of innovation. Innovation doesn't always mean good. It doesn't always mean it works out. It doesn't always mean that it's better than what was done before. It just means it's done differently, that it's new. So if the federal response is focused on animating the private sector and not exercising all of the tools that the public sector has, that is or could be considered an innovation. And then it's up to us as analysts to try to figure out whether or not that has been a good innovation or not so good innovation. In our case, with regard to testing, with regard to personal protection equipment, with regard to shoring up the economy, with regard to a whole range of issues, when there are perceptions among the public that governmental action at whatever level isn't sufficient, we do tend to see a fair amount of innovation. And let me cut that down a bit. I'm just going to mention a few of them. One has been a real surge in organizing and in sort of quasi-civic governance through social media. So through some of the apps like Twitter, Nextdoor, kind of Facebook, but Nextdoor and Twitter have been really, really interesting because they've created virtual communities sharing important information, expert citizens, sort of collaborations. There have been, you know, there's a whole sort of what I joke is the federal diaspora, people that have been federal officials who know how certain things work, have taken it on as a public service to share their knowledge and understanding and being able to explain what's happening in the policy and management realm and in the scientific realms. There has been a surge in public marches and protests, active public engagement with the Black Lives Matter movement, and a number of other issues that have gone along with that. There's been a surge of innovation around food. One of the things that happened during the pandemic is that people lost jobs. The economy really took a hit. People have been hungry, and there have been a number of things going on, from victory gardens in people's own backyards to community gardens producing food for food banks, to a variety of informal arrangements where people are sharing resources, money and other kinds of food exchanges to try to fill in some of those gaps. And masks. So masks have become just an absolutely incredible symbolic and active space for civic engagement. So back in May, starting with some medical folks on the West Coast, a call started to come out. This is before masks were known to be an important thing or a big deal, asking for the public to make masks, homemade masks, because there was a shortage of PPE. This is before it was a public behavior to wear masks for, you know, protecting other people and to deal with asymptomatic infections. And people started making masks at home. People are still making masks. People are ordering masks from abroad and bringing them to neighborhoods. People are using social media to take orders from friends and neighbors and health professionals across the country to sort of fill in those gaps. This is a movement that started in May, and it's continuing. So one of the interesting things about this, there are a number of them, but a couple things I want to point out in the context of public interest technology is that masks themselves are a type of technology. And part of what's going on during this movement is that there's been this very interesting collaboration between medical experts and members of the general public. So this isn't something that members of the general public decided would be a good idea. This is something that medical experts identified as being of critical importance, even though it was not being discussed as a formal public management strategy. And members of the public who knew how to sew became engaged. So this is an expert public or an expert citizen science collaboration that's been extremely fruitful and has led to a number of positive things. Now masks are everywhere and people are selling them. Nevertheless, this civically engaged mask movement continues. One of the things that is really interesting and useful to do is take some of those things I just talked to you about, the definitions of the social ethics that are going on and how that translates into thinking about public interests, and also thinking about the goals of the responses and how some of the I'm going to say the technologically based responses that we might be undertaking satisfy them. What do they do? So it's not just masks. It's whether they're homemade masks or government issued masks or commercially sort of manufactured and sold masks. It's whether we deal with advancing PPE, all the medical protection sort of equipment that we need, using the Defense Production Act, which would not be an innovation. That's the way things are typically done during a crisis. That's where the federal government goes out and cuts through the regular market channels to make sure that materials that we need are produced, or whether we don't do that and we instead try to use the private markets. And I'm guessing that Kevin's going to be talking about to some degree. Same thing is true with tests, whether they're tests to check on infection or whether they're tests for antibodies, whether they're federally administered, designed and administered tests or locally done. It makes a difference in terms of what the social impact will be and how well they satisfy some of those criteria that we may care about. The same may be true for how the pandemic itself is analyzed and how data are collected and reported, how modeling is done, what kinds of things are being modeled, what things do we care about. Same is true for the sort of self-protective orders that might go out, whether it's a nationwide stay-at-home order, for example, whether that's issued at the state level, at the local/city, county level, or whether it's issued at a very, very micro level, such as an office, a campus. The human behaviors that go along with them are different, and the degree to which they can foster social cohesion and stability, achieve public safety and well-being, impact economic resilience, and achieve security could be very different. Same is true about whose benefits they serve, whose interests they serve. The most people, the most privileged people, the most vulnerable, or the most equitable. And we can carry on. During the Q&A, I may come back to this slide. That's why I have this highlighted in yellow, so that we can talk about some of the policies that are out there right now, and perhaps go back and talk about vaccine development and think about some of the issues that are being raised there. And perhaps we can discuss how those things do or don't apply to these criteria that we've been talking about, the social cohesion, stability, public safety, and so forth.